They say life slows down after 40. They say after 40, it's all downhill.
We say it's just the beginning.
Welcome to What She's Having, the podcast that proves getting older is the ultimate glow up.
We are your hosts, Jennifer Cataldo and Brittany Semler, two best friends, moms, business owners, and professional fun havers, living proof that the second half is the better half.
Yes, you can be over 40 and still over the top fabulous, thriving, stylish, and a little bit wild.
Think luxury travel, wellness that actually works. Beauty tips we don't gatekeep, mixed with a little mischief, because aging gracefully is expected, but aging boldly, even better.
We're spilling our favorite beauty hacks, wellness secrets, travel obsessions, and why Botox and belly laughs are equally essential. So come for the fashion, stay for the friendship, and trust us, you're going to want what she's having. We're having what she's prescribing. Today on What She's Having, we're getting real about the stuff nobody talks about, but every female deals with.
From hormones to hot flashes, low libido to high anxiety, Dr. Zafaranchi is the ultimate girl's girl in a white coat. She's helping women take control of their health, their hormones, and their happiness.
So if you've ever had a what the fuck moment about your symptoms, you aren't alone. And today's episode is for you. Because today, we're having what she's prescribing.
Welcome to What She's Having. We're so excited to have Dr. Leila Zafaranchi with us today, an OBGYN in practice over 21 years. Your practice is in Calabasas, and we are both your patients. We love you so much. We feel so grateful that you're here to share all your knowledge. I know personally you've helped me with so many things, and we're very happy to let everybody have what she's having today.
And I will say that I, for a long time, had been seeing, maybe 20 something years with the same practice. And when Jen told me to come to you, it was like a blessing. I will have what she's having. I want the best of the best. And you have helped guide me on my journey for where I am as a woman getting older. And it's been a beautiful experience. So thank you.
Thank you to both of you for having me. I'm so excited to be here. This is such a privilege. The set is gorgeous. I feel like I'm in a Barbie dollhouse talking about my favorite subject, women's
Vagina.
health, gynecology. And it's truly an honor and privilege to be near and next to you guys talking about the most important thing, our health.
Yes.
And our female health.
Absolutely. Absolutely.
Can you tell us what happens to your female health after 40?
Oh, Lord, how much time do we have?
I know.
It's obviously individualized. So 40 is not a hard and fast rule, but as we get older, so I see people from teenage years, literally 12 years on, having hormonal issues, ovarian cysts, pain. A lot of times those hormonal changes kind of ease up on us in our 20s and 30s through childbearing, then other issues will come up. Then when you say 40, that perimenopause period starts happening because average age of menopause in the United States is 51. So that means by age 50, the majority of women in this country will stop having periods. The changes in your hormones usually start 10 years prior to your actual menopause. So it's very common in your late 30s, early 40s to start having symptoms. And it's different for different people, obviously, but a lot of times we ovulate. So we're releasing an egg every month still at 40, but the amount of hormones and the balance goes off. So a lot of times you become more estrogen dominant, your progesterone level starts dropping. That can translate into irritability, anxiety, not sleeping well. And it's a little confusing because that's usually the time that you have kids, little ones or teenagers where they're having issues. So people sometimes brush it off as, oh, I'm just tired or I can't sleep because I have teenagers or little ones. But a lot of times there is a huge hormonal component to it. And it progresses, as you guys know, 40s to 50s. And it will continue for most women to progress into hormone depletion, lack of sexual desire, lack of patience, lack of motivation. That oomph of life, that wanting to be beautiful, wanting to be sexual, wanting to be active and healthy starts diminishing when your hormones diminish. So I think hormone balance is crucial. And a lot of people really don't realize that a lot of their issues are hormonal based and they think they're depressed or they have
Weight gain, maybe? Is there
weight
weight
gain,
gain?
psychological
Mhm.
issues.
Like, wouldn't it even like aging, correct, has a lot to do with hormones as well?
Absolutely. Absolutely. We're born with all the eggs we're ever going to have, right? So, as a girl,
Oh, that's
when we are
wild.
born, that's it. We start, our eggs start maturing at puberty and then they start aging immediately. Men make fresh sperm every 3 months.
Yeah.
We are born with all the eggs we're ever going to release at birth. They just are dormant until each month a few follicles, which are eggs, will mature and release. So, with aging, those eggs are there, they just can't function because they're getting older. And add to that, your metabolism changes, your
Right.
cortisol level, again, our
Yeah.
stressors usually increase with age, they don't decrease. So, that will affect your everything, including sleep wake cycle, weight gain,
Mhm.
metabolism, muscle mass.
Right.
People tell me all the time, I go to the gym, I'm working out just the same. I'm getting a gut, I'm not as strong, and it's a lot of times hormonal.
I think, well, I came to you during a perimenopausal, which I wasn't even aware of. And mine really was like the lack of sleep. And I came to you saying, I don't sleep well. I don't, and you were able to guide me down that path, letting me know that that's the start of it. And do you want to differentiate for our viewers like perimenopausal and
Menopausal,
menopausal,
and then
Very
and then
great question. And postmenopausal.
postmenopausal?
right.
Great question. And people usually come to me and say, "Can you check my blood and tell me where I am?" And that's just one component of the site.
Can I ask one
Yeah,
quick
yeah.
is it as easy as just testing the blood? Like,
No,
blood work says
that's
it all?
no.
Okay.
Exactly, because your blood work will only tell me how much ovarian reserve you have or how well you ovulated that month. And it can fluctuate with your stress level, with travel, with your diet, surgery. If you're on other medication, it can affect it. So, perimenopause is usually 10 years prior to menopause when the hormone changes start. For some people,
That's like a long
that's a
time.
long time. For some people, it's shorter.
Wow.
But for majority of women, if they're in tune and they're pristine with their health, they know something is changing in them.
That definitely happened to me, and I wanna tell my story because I think it's important because everybody has different symptoms, and I was going to an OBGYN who had delivered my babies, and I had been spotting in between, and I wasn't sleeping well, and I had the craziest thing. At night, I would just have itchies. I felt like I had spiders all over my chest, and she's like, "No, you're fine," and she really wasn't interested in helping me through that
What
journey.
age was that?
That was, I would say, 41.
Okay.
And so she really wasn't interested in helping me with that journey. I could just tell. And so I think I found you that way. And it was so great to have that balance to understand like what those symptoms are. Because I also said to my husband, I think my body's changing. He's like, no, you're too young. And I knew, like you said, you have to pay attention. I knew something was off, something was wrong. My thyroid was off. My eyebrows were getting very thin. My hair was getting thin, and I just didn't feel vibrant. I didn't feel very sexual. I just didn't feel good. And I'm the type of person that will continue to search for the answer. And
I love that.
yes, and I'm so grateful that I found you because you are like the
Mhm.
Barbie doctor. You come in your stilettos and your like red
Love you.
lipstick and you are so elegant and classy and it's incredible to relate to such a lady. It helps all of us through the process because there's some scary tests and
It
uncomfortable
is. It
tests,
is.
but you not only do you help with the bioidentical hormones, but there's other vaginal health things that you do.
Mhm.
So
Absolutely.
I definitely want to get into that. But going back to you have perimenopause, so is that when you start like hormone replacement depending on your hormones?
Depending on your hormones and depend it's a clinical picture. So your family history, your own risk for breast cancer. We always have to make sure you're safe, you're healthy. So, getting the appropriate testing done before you can't just go and expect hormone
Mhm.
replacement therapy because sometimes that may make you feel worse. Especially traditional medicine is let's give you some birth control pill. Your 40, 41 birth control pill will not only make you not feel better, actually it may make you feel worse because the synthetic estrogen and progesterone
Mm.
are not the same. So I think it's really important for your viewers and people listening in to know the type of hormone replacement, they're not all equal. So bioidentical hormones are not the same as synthetic hormones that are in a traditional birth control pill.
Oh, wow, I didn't know that.
So bioidentical would be considered like natural.
That your body
Correct. That
recognizes?
your body would produce the exact
Okay.
same. So, for example, the estrogen is called 17 beta estradiol. That's the type of estrogen that our body produces monthly. So, we want the exact same type of estrogen versus what's in the birth control pill. It's like ethinyl estradiol, which to the average listener, these are all Latin names, but it is important to know they're not the same. They
Yeah.
don't bind the same way to our receptors in our body, our reactions. For example, natural progesterone is a diuretic. You sleep better, you lose weight. Synthetic progesterone usually bloats you, you gain weight, you don't feel well.
Mhm.
And people sometimes don't recognize that and they go to their practitioner who's not aware of perimenopause treatment and menopause. And back to the question. So perimenopause can last anywhere between 6 months to 10 years. For some people it really is a 10-year process. Then once you stop having your period, you're still not postmenopause. 1 year of no bleeding is the definition of postmenopause. So for some people, they may skip 10 months, get a period, the clock starts again. So all of those years
Oh.
where you're irregular, you're in that perimenopause. When you stop having periods, you're menopausal, but you're not postmenopausal till 1 year of no periods,
Wow.
So
like 12 months.
is there not so there's a peri is there a menopause and a post, or is it only a peri and a post?
You know, they use it interchangeably. So perimenopause and menopausal could be interchangeable, postmenopausal and menopausal. So it's a lay term, layman's term.
Right.
So we don't use that when in medical term we say menopause, it's the same as postmenopause. So we only have perimenopause and postmenopause. So either you haven't reached the menopause, it's kind of like getting your first period,
Mhm.
then
Yeah,
you've had
yeah.
it. So 1 year of no bleeding marks that postmenopause. So then people use menopausal interchangeably with peri or post.
Wow, we have a lot to look forward to.
And
It does get better.
these medicines help you, like, it helps you with the hot flashes, it helps you I know for me, with a progesterone is like a lifesaver with the
Mhm.
sleeping.
Absolutely.
I asked my mom, several years ago before I started, dealing with this. I said, "Mom, have you gone through menopause?" And she said, "Huh, come to think of it, I haven't had my period in like 2 years." So she had no
Oh
symptoms,
my god.
and she wasn't, like, self-aware until I asked her that she
Wait, she
had gone
hadn't
through
had
it.
her period for 2
Yep,
years?
and didn't even my mom's
But
just
it had
like,
to have been longer,
she said,
correct?
"No, no, I haven't had my period for like 2 years." And I was like, "Wow." I was actually thrilled because I've seen so many of my friends and their moms where they stick their fans in their cleavage and they're having dinner with the fans
Yeah.
on and they're
Ice
sweating.
packs.
Yes,
Yeah.
and
You're sitting with them and all of a sudden they just get wet.
I
yes,
know.
and I'm so grateful because I was hoping that if that's what her kind of transition, was into it without any hormones, like, then it won't be so bad for me. So, I'm very grateful. There's another thing that I wanna talk about is I love biohacking, I love all of that stuff, but I did come to you. I had gone to a different doctor, and we'll talk about my journey. And I had the pellets, and the pellets are amazing, but they're not great for everybody. And for me, I actually ended up gaining 6 pounds every time I got injected, and I'm 5'2", so that's a tremendous amount. And I just was so swollen, and yes, you get, like, so horny that you're like, "Yes, I'm, like, 16," and so
Yeah.
you're like and so you want more and more and more, and you keep on going back for it, but then you're like, "Wait, there's other changes that are happening," and I came to you, and I had a pap smear, and do you remember? You were
Yes.
like,
I knew you had gone somewhere and gotten
"Mhm.
hormones because she had developed cysts that she had never had before. And thank you for sharing your journey. And it's so bold. And I just,
Yes."
more power to both of you because I think it's very vulnerable, but it's amazing that as women, we talk about what we've done right and what hasn't worked for us. And as you said, everyone is individuals. So you have to talk to your doctor. But in general, I'm against pellets because of the side effects. Also, just really quick, when you overdose any hormone, including testosterone, pellets are bioidenticals. They're wonderful as far as bioidentical hormones go, but they are, testosterone is a steroid-based hormone. So it doesn't stay as testosterone in your body. A lot of it can get converted
Mhm.
into even the bad estrogens, which can increase your risk of breast cancer. So I encourage people, if you have listeners who are on pellets, they love it, ask your doctor to do a 24-hour urine analysis. There are many companies that do it. It's very affordable. The kits are very accessible. You literally urinate for 24 hours and collect it, or there's the strips that you can use over 24 hours because one spot check of blood
Mhm.
will not tell us what's going on in your metabolism or tissue level. And then we can look at the metabolites and tell you if your risk of breast cancer is being increased by a lot of conversion of this high dose of testosterone into your bad estrogens that can increase your risk of breast cancer. So I have had patients on pellets that I've checked their urine and it looks good. And I've had ones that I said, please stop immediately because the majority of their testosterone was converting into the dangerous estrogens that those are for people who are in the science field and want to look it up, 16 hydroxy and 4 hydroxy estrogen metabolites are very dangerous in our body and we need to get rid of it and methylate it and detox. If you're accumulating that over years and years, you will really increase your risk of breast cancer.
I'll never forget you said to me, "You're getting something good now, but later, it's not guaranteed,"
Yeah.
and we know for me, my journey, it was true because once I went off of it and I just met with you a couple months ago when I asked you to be in our podcast and you said yes, you I had an exam and you said, "I can finally see your cervix."
Absolutely.
Mhm.
And that's so scary to me,
Yes.
because people don't realize they may feel great, but if you're fixing one problem and creating a different
Yeah.
problem, at the end of the day,
It's not worth it.
it's not worth it.
It's not
I
worth
want
it.
to go back to why I appreciate your practice so much because you really walk hand in hand with your patients through the journey. And I love the idea of preventative. Like you take action before it happens. So when I went to your office, I'd never done these full blood work panels. And so every time I come into them, I was like, gulp, because I'm terrified of because my levels of random things, like my estrogen is always so high, we can't figure it out. And you give me my list of stuff that I should, trial and
Avoid,
error, let's
yes.
try this. But you're always very worried for me because I was very gung ho about I want to go do the pellets or I want to go do the
Yes.
testosterone shots because my sex drive I was very worried about it. And we kept thinking, but my testosterone is normal. And you're worried that if I were to do that, that testosterone, the extra would turn into the
Bad
estrogen and
estrogen.
Got
I
it.
would have more problems down the road. So
Yes.
one, thank you because I love how much you look out for us and along with the blood work, you do the ultrasounds, you
Yes.
do all the annuals and not only do you guys do it, but you almost stalk us. Like your office is
Yes.
so good
Thank you.
about assuring that we are on the books and we are calendared for these checkups
Absolutely.
because we forget. And I came in forgetting to do a mammogram on time and had a panic and life got in the way. And you guys were so great because I couldn't get in immediately. And you said, let's get the ultrasound tomorrow. So you feel a little bit of comfort
Absolutely.
and then you go for your mammogram immediately.
Absolutely. Thank you for bringing that up. And I'm so appreciative of you appreciating
Wow.
our staff in our office. But three great things. to your point that you brought up. One is please get your exams done when you feel great, because by the time you have excessive bleeding, pain, bloating, it's not prevention anymore. People think symptoms come at the beginning of a disease, heaven forbid, or a cancer,
Mhm.
but that's not true. Usually, symptoms, our body will compensate and compensate until it can't anymore.
That is so
So
That's
scary.
interesting.
That
that
is
is so
very
when
Hmm.
people say,
scary.
"But my breasts feel fine. Why should I go in for a
Yeah.
mammogram or ultrasound?" Because we want to find it
Before
when
it,
it's
yeah.
a dot. That way, you don't need chemo. You don't need radiation many times. You can keep your breast tissue and have a small little surgery. When something has progressed, then your surgery is much more aggressive. You end up probably with mastectomy. You end up needing heavy duty chemotherapy because things have already spread. So, pound for pound, if you're going to, heaven forbid, get cancer, if you find it in its infancy, literally you're turning the page, you're getting rid of it,
Yes.
and you can be cancer free, versus when it's already spread into the lymph nodes or into other organs.
Are you seeing now with women going out and doing stuff like this, and even with the foods that we're eating and everything in our world, are you seeing more of this in your practice than you did, say, 10 years ago?
More of cancers.
Cancers and
I have to, and I, is there wood here? I'm
Yeah,
gonna
that
knock on
is.
wood. In
Mhm.
my patient population, I honestly feel like partly it's us, but partly it's you guys are so I'm not seeing it. But let me tell you, I practice in West Hill, Calabasas. People are non-smokers. They eat healthy. They
yeah.
take care of
Right.
themselves. Most of my patients come in for health. They don't wait for illness. So they're there to prevent. So thank God I don't see that, but we are, as you know, on it. I start checking
Mhm.
hormones in people's 30s. And one thing that I think it's important, check your hormones on your period. Your period is your reset point when you're
Yes.
young. If you have tons of estrogen that you're not detoxing during your period, your body has an issue with the
How do you help
detox.
detox your estrogen?
So we'll find the problem. Are they producing too much estrogen? A lot of times I find it is external exposures, from plastic to,
Mhm.
and you guys know about the list, lavender
Mm.
oils, a lot of the essential
Lavender
oils,
oils because there's plastics in it. It's
not
synthetic?
plastic.
It's synthetic?
Lavender oil by itself will increase your estrogen.
Really?
So a lot of the essential oils that you can put on your
Wow.
skin,
What
on
about
your body,
perfumes?
perfumes can do it. They have a lot less compared to purified oils. I had interesting case. One of my lovely patients, if she's watching, she had twin girls. This is years ago, and one of them couldn't sleep, so she was spraying lavender
I've
oil
done
for
it,
her.
yes, on my
I
daughter's
put I
pillow.
put it in tissue. I used to put it in
Uh-huh.
tissue in my kid's pillow.
So
Oh, no.
both of them were 7. One started grow the one with lavender oil
Oh,
and is
that's
started
terrifying.
growing breast tissue. So she comes panicking, and we're just trying to figure it out. I'm checking her levels, and she's obviously 7. She's not even anywhere near puberty. And then I kept asking her, "What do you feed her? What's different between the twins? You have twin girls." She said, "Well, I don't think this is important, but I have been putting lavender all over her. I'm putting lavender spray."
Wow.
That is
And she
wild.
stopped immediately. Her estrogens went back to normal, this little girl,
Wow.
and her breasts went back down.
Wow.
And she resumed normal
Oh my god,
growth,
I'm going
which
home and throwing away all my lavender sprays I've bought for
and
my
I
daughter.
love
My
lavender,
daughter
but
loves it.
it is lovely. But at higher
Yeah,
doses, the
not the
And not
risk.
on
purified,
your
Yeah.
body.
and
Definitely not
not
on your
on your
body.
body. If you're spraying the pillow or something, that should be okay. But really, we don't think about these
No.
things. So when you
Yeah.
said, what do you do? We become detectives. When I find someone's estrogen is super high when they should be detoxing, on your period, you're not ovulating, there should be no extra estrogen. And then you select an egg, ovulate, the estrogen and progesterone will increase. Then either you're pregnant or you're not, you get your period, everything should go down, right? So this is a cycle that is very normal, healthy, and you know, um, it's something that many doctors will not check. So please become informed
Yes.
consumers. And I'm hoping by being on this podcast and you lovely ladies
Mhm.
sharing your stories, that it inspires people to really seek physicians that will listen to them, that won't be like,
You're
"You're getting your
fine.
periods, you're
You're fine.
Yeah.
fine, you're
Yes.
fine."
Very
There's
dismissive of it.
most
Very
doctors are like
dismissive.
that.
Yeah.
"I can't sleep." "Well, you're getting older."
Right.
"What?"
Exactly.
"I'm
Take
41. How
melatonin.
am I?"
Like when I came to you and I'm like, I'm usually very
Yes,
sexually
yes.
active and want to be with my husband. And I'm like, God. And we went through
Absolutely.
everything we needed to, and we went to
Absolutely.
the testosterone creams, which did help a lot.
Yes, yes,
And
and
I'm
that's
learning it's
really
my age that things
It's
change.
normal,
it
right? It
is
is
it is
normal.
normal, but not dismissive normal.
Yes.
Yes,
N
yes.
I tease and say it's like gray hair and wrinkles, like, everyone gets it, nobody likes it, right?
Right.
So,
Yes.
normal
What can
is
you
a
do about
very
it?
loaded word because most of us will color our hair and
Yes.
Yeah, yeah,
do
yeah.
Yeah.
everything we
Yeah.
can to
Yeah.
stay youthful.
Mhm.
Why wouldn't we want our insides? And hormones are the most intricate part of a female body.
Yes.
And I really feel the cookie cutter medicine. Even with pellets, my issue is there's only a few doses that you can use for any shape, size,
Yeah.
height,
What's
ethnicity.
terrifying for me with those is once you put them in, they're in. You
For
can't,
three
so
For
they're
months
3
or
time
months.
6 months or
released.
longer.
To me, that was terrifying to
It's
hear
terrifying.
that you can't get them out. God forbid
Exactly.
you get terrible news and you're now worried because you have
Oh my
something
gosh,
inside of you that
absolutely.
you can't get
'Cause it
out.
takes time
And
to release in
and
your body.
Yes.
and many of these clinics will not check a mammogram. They're not checking ultrasounds.
Yeah,
They're not following levels as diligently as they're supposed to.
absolutely.
So I really feel like if you're going to do pellets, please go to legitimate clinics that really, if someone is not checking things out and they're just putting pellets in, not requiring mammograms, not checking your uterus and ovaries, I don't think they care about your health, honestly,
Yeah,
because you can actively harm someone. As you said, if someone has breast cancer and you're putting a pellet, they're
that is
doomed to
so
have it in their
scary.
system for 3 to 6
That's
months.
so
You can't take it
scary.
out.
Yes.
I want to also go right into the fun stuff in your office.
Yes.
Yes.
Like we were talking about this episode, keep it tight, keep it right.
Right, that's what we called it. Keep it
You
tight, keep it
are
right.
that
I
girl.
love that.
And we so love you for that. And our husbands love you for that. And explain to us your philosophy on why you do have all these amazing procedures
Yes.
in your office and things that you do surgically too,
Yes.
to really, because beauty is, you can't just stop here. It's
Absolutely.
that ages as well.
100%. Plus, add maternity, getting pregnant.
Yes.
We
Mhm.
all gain, I don't know, 25, 30 pounds at
Yeah.
least during pregnancy.
And then you do
Everything
IVF with
swells up.
hormones that makes it,
Exactly. So, all of that stretching and deflating, then carrying each pregnancy for 9 months, where you're putting a lot of pressure on your bladder, on your vaginal area. And truly, most of us who've had children, you look at yourself and you may lose the weight, go to the gym, nothing feels the same. Would you guys
Right.
nothing,
agree?
Yes,
Nothing
100%.
is
absolutely.
the same. Bladder is not the same.
Right.
Vagina is not the same.
Mm-hmm.
Whether you have a C-section or vaginal delivery, to get a head this big out of a woman's body,
Yeah.
something's got to give.
There's a price that you pay.
There's a price you pay.
Tell me
Uh-huh.
if this is true. When you, because I kind of explain this, because I talk about all the procedures that I've done with you and I love them so much. My husband wants to come and give you the biggest hug. Just say that. But I explained this the other day to somebody that, as we age, we get facials, we do,
Absolutely.
Mm-hmm.
microneedling, we do all these things to stimulate collagen, to take care of our skin. And the collagen leaves our face as much as it leaves down there, right?
Even more so if you think about it, because how much pressure are we putting on our
Yeah.
vaginal area just by sitting every day? Just
Yeah.
Yeah.
so if we slept on our faces that long and put all of our body weight on one area, it would even deteriorate faster, than so
Yeah.
you're absolutely right. But in addition to function, a lot of women will have urgency, frequency, incontinence. They'll have a baby and they're like, "Oh, but you
Me.
know what? I only when I sneeze or laugh or jump, a little bit of pee comes
Mhm.
out. And I'm like, that's not okay.
So
Yeah.
Like,
that's what happened with
you
me.
shouldn't pee at all
Yeah,
on
never.
You
yourself.
shouldn't be worried about it.
Yeah, and
Or
it's a stressful
it
thing.
is a stressful
Mhm.
thing, and people will stop doing some of the stuff they love. Like they won't get on the
Yeah.
trampoline with
Yep.
their kids.
Yes.
They'll stop going to some of the Zumba classes or dance classes or anything that
Yeah.
requires jumping because they're so concerned that they are not able to control their bladder, which is really sad to me. Your bladder should not become your limiting factor. In addition to sexual function, blood
Mm.
flow, and the beauty, form, function, beauty. So I feel you said what makes me so passionate about vaginal health and women's health. I love the cosmetic part, but I really feel like they're so intertwined with great function, with great bladder function. Sleeping through the night. Women get up 2 to 3 times a night to go and urinate. That disrupts your REM sleep.
Mhm.
When we really get that deep, restful sleep, we're waking up because of our bladder. And so we want to diminish that and naturally improve your tissue. So
Yeah.
not only it'll look great and youthful, and you guys are going to be 25 forever,
Yeah,
obviously.
we talk about it. You're like, "Oh, you have a 25-year-old vagina."
And
That's the
it is.
goal.
It is. And I've had patients, I swear, will show them their before pictures, which they've
Oh,
never
hang
looked
on.
at.
That's
Okay,
the
okay, we
funniest
need to talk
part
about
is the
And
this.
before
thereafter,
and
and some
after.
people will start crying,
Talk
like
about not
literally crying.
liking a photo taken.
Right.
That's like the most, that's the wildest photo. I think you're just,
Absolutely.
okay.
Well, I'm gonna say this. I remember you showed me my before, and it was like this. Meow. It was like meow, like a sad vagina. And then you showed me the after, and it's like,
Well,
and
it's
that's the truth.
matching that gorgeous face of yours now.
And I said, oh my God, I have to apologize to my husband. I had no idea what it
Oh my
looked
God, I
like.
was so hoping you would share this
Yes.
because I have to say, Jennifer, you are the cutest. I have never, in almost 21 years of my practice, had someone say, I have to go and apologize to my husband. I was mad at you and wanted to just hug you and kiss you because
Yes.
that shows what an amazing, gorgeous, pure soul and heart you have. That you are the one suffering with all the
Yeah, that's
tendencies and
true.
all the issues, and you were still kind enough to want to go.
Well, because I'm like, wow, you had to look at that all the time. That was so pretty. But now she's a good one. And that's what's so great because I did come to you and we're sharing all the information here because I did come to you. I had bladder issues. I had met with a urogynecologist who said he wanted to do all the surgery. And you said to me, please don't. Can we do a few things first? You're going to have this mesh in you. Sometimes your husband can feel it when you guys have intercourse and you can get infections. So let's try these things. And the things that we tried were the Mona Lisa and I did the chair.
And
Let's
we'll
talk
talk
about
about
that.
that. Did you want to
No, I
something
want
add
you
to
to
that?
explain exactly what those are and why they're so amazing
Absolutely.
for the outside
And the
and
And
inside.
the
the
inside.
inside.
Absolutely. So Mona Lisa is a CO2 laser that is an Italian company that has made the specialized laser for inside and outside of the vagina. What it does, it stimulates, just like we get facials and lasers done, photofacials, microneedling, all the things that stimulate our skin can stimulate the inner skin of our muscle, collagen. It even improves the blood flow 66% to that area. One of the things that if for your viewers and listeners, that happens, and you can take a mirror, you are not
Mhm.
the same color and
Right.
That's,
consistency as you
yes,
were
It's a
20
shocker
years ago.
yes.
because you never
That's why
take a mirror.
the before and afters are
Are
so
so,
important.
so
So
important
you
because
can
we're not used to
see
it.
Yes.
what,
And what your potential is.
yes,
And
yes.
this is all natural. There's no chemicals,
Yes.
there's no medication,
Let me just
no
get a little
surgery.
graphic. Ladies, your vagina gets gray, ashen, a little deflated, and
Sad.
we have it's very sad. Like it's a
Mhm. It's like a
vagina
prune.
and
Can we say empty ball sack look?
exactly. That's a
Yes,
good one. Like your
yes.
vagina looks like an empty ball sack if you don't take care of it. And we have all the
Yes.
answers.
Yes. And truly we're talking about an easy 15-minute
Yeah,
in-office procedure
very
that
easy.
with a numbing cream, honestly, it is not would you say it's painful? And be honest
No,
with
No,
what I
no,
love
because
so
you
much
numb
about
it.
you is you're like, "I don't want anyone to be in pain," and I'm always worried,
Mhm.
and here's the cutest thing about you, I always say, because I told you about this procedure first, and I love that you just do whatever I do, and it's so good, and I'm like, "She is like a captain in the ship. She's going like this, she's driving the ship, she's talking to you while it's, like, up your vagina, you're chatty, 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 you're trying to get all of our, like, mind off of what's
Yes,
actually happening
yes.
as, like, the smoke's coming, and you smell burnt hair, and you're like, 'What is happening to my vagina?'" And you're doing it in your cute little way with your little lab coat and your stilettos, and then it's done.
And honestly, 15 minutes, the inside feels like a vibrator, honestly, and
Yeah,
a
yeah,
puff of
yeah,
air.
yeah,
Yes.
yeah.
It is so easy because a lot of people are like, "Oh my god, laser inside my vagina."
You don't
But
feel it.
truly, there's no pain.
It is a
Um,
game
it's a
changer.
game changer.
My
It
husband was
really is a
like,
game changer.
But it
"Whoa."
And our
also
partners can totally
They
tell you.
know.
also explain what that does for you sexually as well, that
Absolutely.
the benefit
For sure.
sexually.
So what does Viagra do for men? It improves the blood flow to their genital area. And that when you don't have good blood flow, you're less juicy.
Mm.
Your sensation, any good sensation is gone, and you just feel pain and discomfort, sometimes burning, itching after sex if you're dry. The painful sensation of tearing skin will progress as people go through menopause. So, what it does is it reverses all of that. So, you collagenate 70 to 90%
Wow.
improvement. And
Wow.
this is biopsy, skin biopsy proven of before, not just picture. Like if you take a piece of skin from the vagina, look under the microscope prior to the 3 treatments, and then take it, same piece of skin after 3 treatments, you will see that the collagenation has improved 70 to 90%. The blood flow to that area increases 66%.
That's
So good,
huge.
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 So you are improving your immune system also. A lot of my patients, including my own mom, hi mom,
Oh, I love
um,
this.
um, my dad passed away. It's about their own health, prevention of urinary tract infections, prevention of prolapse. And,
Mhm.
prolapse is when your bladder starts coming out of
Yeah.
you
So the
as you
Mona
age.
Lisa will help, like, bring it up and
Bring it
keep it
up.
in
And
there.
I wish we could show before and after pictures,
I
but I
know.
know our site will be taken down.
Yeah. Yes.
We'll come to your office
Yes,
maybe and
yes,
do like a
yes.
video that they could just see the machine
Yeah, yeah.
because it really
Because
is
truly,
such a
when you see
great.
it, and I can show patients in the office
Mhm.
of people who volunteered for being our models for before and after, but it really is honestly, a game changer. And I feel
Agreed.
like, why should we change in our vagina and sexually the way our grandmothers did if we're not changing that way with our hair and skin and
Mhm.
We
seriously?
cannot go down without a fight. Ladies, you have to
Oh my
Mhm.
gosh.
fight. You have to fight to keep it right and to keep it tight.
And
Mhm.
maintenance.
Yes.
You wouldn't have a house for 30 years and be like, "Oh, the roof has to stay the same.
Yes, the leaks have
The leaks
right.
are good.
The
Yeah.
It's
pipe
okay. Let's
burst.
let's keep going."
That's a great
That's a very
analogy.
good
That's a
analogy.
You
great
would re-roof it
analogy.
and be like, "No, our
Yes.
So
house is amazing.
when
We're
you
keeping it."
when you couple this treatment with the chair, talk about the
Absolutely.
chair because that's
Absolutely.
something
So
super
the
cool.
chair is actually Emsela BTL. That's a Czech Republic company. And I have to have my grievance with, why are we in the United States behind Europe in creation of women's health machinery? Honestly, that breaks my heart, but that's aside. And so my little pet peeve is, please support physicians and offices and practices that are doing these, because ladies, if we don't support these industries, what's going to happen to them?
They're gonna
Yeah,
go
they'll
away.
go
They'll go
away.
away. And Mona Lisa is not even advertising in America. They're mainly in Europe, because how many doctors' offices do you think actually offer this? Don't look at LA and California. We're talking
Yeah, like if
nationwide.
there's the
Oh, that's
flyover
such a
states,
good
yeah.
point.
It's
It'd
it's
be
not
interesting to
talked
find
about.
out.
It's
Yeah.
very far and few between, because insurance doesn't cover it. The machines are 200
Yeah.
to $240,000 a piece, so they're not
But I
cheap.
also think it's just in general because we're not, I feel like here in the US, sometimes we're not as in tune with that part
Thank
of our
you.
body. So, and
Absolutely.
it's sort of a faux pas to talk about sex or
Thank
vaginas or
you.
intercourse and what this does for you. And women get lost because we're not like, I think people think like, oh, women aren't supposed to feel good all
Oh
the
my
time and
gosh.
women
Yeah.
aren't
Right.
Yeah.
supposed to enjoy sex as much. And no, we are.
Absolutely.
We're supposed
Absolutely.
We
to
you know,
be into it.
we had our husbands here on, one of our episodes, and we talked about, like, what keeps things spicy, what keep things right, and my husband said, "I take care of myself. We take care of ourselves."
Mhm.
And we have to take care of ourselves.
Absolutely.
For our partners, if you wanna have a healthy relationship, you have to be healthy down there. You have to feel good about your body. You have to feel good about intimacy, and I could
Absolutely.
really
And
see how this could affect a relationship when you don't
for
take
sure.
care of that.
Absolutely. And I have people who come into my office and they're like, my husband is the best, amazing partner. We haven't had sex for 5 years because he doesn't want to see me in pain. Like
Oh,
he's
Oh,
wow,
such
that's
a good,
tragic.
and
that's
it's tragic.
heartbreaking.
And they do other things, but they're not able to have
That's
intercourse, which
sad.
is, I think it's just
It's one
unacceptable
of the
in this
greatest pleasures of
Yeah.
life.
Absolutely. And how sad is it for a wonderful marriage of two people in love and attracted to each other to not be able to have
What can
sex?
we say to people listening to go and find this that aren't here? Obviously, if you're in Southern California, we're going to find you.
Thank you.
But if you're not here, where are they looking for this to get these types of
Absolutely. I
treatments?
think Mona Lisa Touch is there. They have their websites and physicians that do the CO2 vaginal lasers, and there are other machines. I have used all the different machines, and again, I've been practicing for a long time. I'm very, very particular about the least amount of pain, the most amount of results, the best bang for your buck, where you can sustain it and it doesn't harm anything else, or the risk is like zero, basically. And I find that the CO2 laser has done that. There are other modalities. So you said who to find. You have to look, you can go to Mona Lisa Touch. Also for bioidentical hormones, A4M, A as in apple, the number 4M like Mary, is the fellowship that we all do for learning about bioidentical
Oh, wow.
hormones. So you can go on their website and look up physicians that actually do bioidentical hormones and are trained to read your numbers, do the appropriate testing. So there, I would go to the main sources because vaginal rejuvenation is such a big umbrella of things.
Yeah.
But majority of OBGYNs, if they're advertising that they do this all the time, they're probably good at it. And just go to a clinic that is MD. You don't want to go to day spa and get your vagina lasered
Oh,
Yeah, yeah,
that's
yeah.
great
because all the
advice.
disaster stories that we hear are with mid-levels that are not trained to use appropriate
Well,
precautions.
especially
Yeah.
going to someone who has your accredited background, like, you wanna go to somebody who understands that part of
Absolutely.
your body.
Absolutely. And the Emsella BTL, the chair that we talked about, and we went on tangent because of my grievance with Czech Republic making this and not United States. So it's a chair that is magnetic resonance, MRI, that you sit on. So you don't have to take your clothes off. Basically, you sit on it with your clothes, and it gives you 11,000 kegels, which are contractions of those pelvic floor muscles that hold your bladder up and
Mhm.
holds everything up. 11,028 minutes. Literally, you're sitting and doing nothing, which is lovely.
So you can rebuild that muscle and
Absolutely.
tighten that muscle.
It is like
And it and
physical
it and it
therapy.
worked. I'm gonna say for me, I'm your number one
I love
fan,
you.
number one patient, and I've done all of this,
Yes.
and it worked, and I have not had to have surgery, and I'm
Thank
not
God.
sneezing and peeing. I'm not riding my horse and peeing. I mean, it's
Yes,
honestly, it is
that's
a game changer, and
amazing.
I
That's
didn't
amazing.
have 6-week downtime of recovering from a surgery that I
Absolutely.
was worried wasn't gonna
Scar
go
tissue and mesh and possible
exactly.
issues afterwards.
Now, there is one more thing that we can talk about when you said, you have juicy lips. So we can talk about
Lips and lips.
the next thing, which another thing that I've done, because I will try anything. I will try any
Love it.
procedure, any peptide, any injection, any surgery. I'll do it. But you do, and you do fillers in
Absolutely.
your lips.
But
Absolutely.
explain why this is so amazing.
Okay, so just like you said, who wants deflated lips on their face, right? And so for a lot of my patients, they're gorgeous, like both of you. They take care of themselves. They are wearing bikinis. They are wearing their yoga pants. And the last thing they want to feel and see with their partner or in their own, skin and comfort is the saggy, deflated skin that after having children, sometimes with weight gain, weight loss, or just aging, will not have its plumpness. So we'll start with the lasers, but depending on how much deflation there is, sometimes that collagenation is not enough. And so, um, and not to get
It's
graphic,
such a bad
but
visual
when your
for me.
but
Oh, but
when
I've
your
done it.
outer lips, when your
Fluffy lips.
No,
yeah,
I mean, it's
but
not.
also makes your inner lips look
Yeah,
worse.
it's not your
And Jennifer is going for the gold, just like her. So she was. I make
tell her I
gorgeous
have a pretty
people eat.
pussy.
Oh,
Say,
the
Brittany.
best, the best. But honestly, I make gorgeous people more gorgeous. So there are some people that one cellulite and they're like, oh, my life is over. I need to lose weight and fix this, right? So yes, your visual is like an extreme. And most of those extremes are not seeing me or other doctors.
Yeah, and they
It's
need surgery.
usually amazing, gorgeous people who just feel like they're not what they used to be 10, 15, 20 years ago or prior to children. And on a note for your younger listeners, American College of Obstetrics and Gynecology just put out a paper actually last year. Women should be seeking some of these like chair treatments after having children. A lot of times we have a baby, you're breastfeeding, you're busy, you have another kid, and they say, oh, do your Kegel exercises.
Right.
Is that a myth?
How many
Do
of
you
us do 100 Kegels a
No.
day?
No, I
I
can
don't
do.
think
Ever.
I've
I'll do 3, and then I'm distracted.
Thank
I
you.
don't think I've ever
Mhm.
done
And
one.
to do
Do it now.
effective, and so after you see your OB, they're like, oh, you're good to go. Just strengthen those muscles and do your Kegels. And you're like, great. You go home and you're up 36 hours of laundry and breastfeeding
Yeah.
and kids, and you forget about it, right? So years go by and your bladder symptoms will just get worse. So truly, I really think, and I wish it was available when we had our kids, to immediately within, well, not the first 6 months, but after 6 months, get into your OB, get on the chair, strengthen we don't wait to lose weight till we're 50 and say, well, we had the baby at 25. Let's just
Yeah.
wait on
So
this
again,
baby.
you're
Wait.
saying this is preventative
Preventative.
so that you don't go down the road where you're later having
Because
major
absolutely, a
problems.
lot of patients are told, oh, it'll just get better. Just
You
wait.
have to be your own advocate.
Do you know
You
what I
have
mean?
to
Yeah,
take your
yeah.
And
health
they
into your
wait and
hands.
wait, and it
Yeah.
doesn't get better. It only gets worse. So
Yes.
after 6 months, if you're still leaking, if you're still feeling nothing during sex, and it's loose tissue that has no sensation, you need to seek treatment right away. Don't wait years and years because it's harder to treat a chronic problem than it is to
But
treat
you're
a
also if
problem at its origins,
if you
Yes.
go in right away, like you're saying, and not only preventative, but you're also like you're rather than just helping it along the way, you're I would imagine encouraging more of it.
Absolutely,
More of it. So even
absolutely.
if your body went back to normal over time, like, after having kids, it does. It goes back, not all the way, but it does a little bit. This would help you
Yeah.
a
And
lot,
some
lot more.
very few people will go all the way back to normal, I would say, in my
Yeah,
experience,
yeah.
truly.
Yeah.
To think of pre-pregnancy,
Right.
Oh,
Unless you have
yeah.
surgery, right?
unless you have surgery or you're seeking these treatments.
Right.
Honestly, the honest truth is that's why in Brazil, probably 80% of people have elective C-sections because they
Yeah.
would
Wow.
not push a baby out.
I had C-sections and
So it's much less damaging than
well,
had you
I
been.
also had I did a lot
Yeah.
of I cleaned that shit right up.
But I'm saying it would have been that much worse
Yeah,
had you had
yes,
especially
yes.
long
Well, especially because I
labors
had
and
twins,
big
I
baby, yeah.
mine would have been
But carrying
terrible.
the twin probably did more
Yes.
damage to you
Yes, I
than
was
if
very
you
low.
carried them one at a time. Does
Yes.
that make sense?
Yeah, yeah. After the twins, that's when I
For
was
sure.
like,
No, but
"Oh,
but I'm saying
fix
like
this
let's be
shit."
real about this. Yes, you will go back to normal, but
Not
if you're
not what?
lucky
Yeah.
90%, like that's on a really really good healthy no damage individual and smaller, tiny frame women. Our bodies are not designed to have big babies. That's the honest truth. So babies are getting bigger and bigger because nutrition is really improved. So, a lot more C-sections are happening,
So a
but
lot
don't
more
be upset
vaginas are
about
getting ruined.
a lot of more
They
vaginas
all
are
need
getting
to come see you.
well, I will be at your service.
Are the chairs available more? Because when I, went to that urogynecologist, he was the only one in the country who had the chair, and then when I met you, you had the chair, and that was my tell of how good of a doctor you are and how you really take women's vaginal health seriously, and I was so grateful to find you.
Thank you. And Emsella BTL, again, they can go on that website. There are more and more. That's the only one that if you go to a day spa or a clinic that has it, because you just sit on the machine and the preset, as long as they know what they're doing, which I'm sure they do, is not operator dependent.
Because it's not
But the
inside of you.
laser, absolutely. Lasers in the state of California, I think you have to be at least a nurse practitioner or a PA to do lasers. But in general, I would stick with physicians that do this all the time.
100%. And especially because it's a CO2, so it
You
could
could get
Exactly.
be
burned.
aggressive and very
It could be.
You
And
could
damaging.
if
get
you don't
burned.
know what you're doing or you start getting creative on your,
And the way you numb us is, like, very important. That
absolutely.
protects you.
Absolutely. We are trained not numbing women to do the lasers.
That's
And by
You
crazy.
men,
mean to
no
do that
offense to men,
without
I swear to God, when I got trained, they're like, "Oh, it doesn't hurt that much."
Oh my
they're
And
gosh.
like,
I'm
"You
thinking,
pushed a baby out of that. You could do this."
Can I laser your balls? I'm sorry.
Yes.
And be like, "Oh, honey."
Let me laser your taint and see how that goes, guys,
Right?
okay?
It is unacceptable to me when you know you're gonna create
Yeah.
controlled environment pain to not offer pain relief. And I feel that way about IUD insertions, about biopsies.
That's
We
true.
even have Pronox in our office.
I've done
Some
all that with you.
absolutely, because I really feel like you can make it a lot less
Well, that's why
painful and upsetting.
it's such a pleasant experience going to you because there isn't. Otherwise, people wouldn't be coming
Yeah,
in.
that's
It's
true.
I
very
mean,
traumatic. I remember my first gynecologist when I was 17 and he was a man and I went in for my appointment. I came out and I started to cry. It was awful. It was so painful and you're a woman till you understand.
And I think people have choices. So please, if you go somewhere and they're not listening to you or they're causing pain I mean, yes, PAPs are uncomfortable, but there are procedures that we can do
yeah.
numbing and other things. And I've seen more and more posts on Instagram and TikTok by OBGYNs talking about this. And I'm really happy about that because they should be giving paracervical blocks and numbing creams. And those should be routine. I really don't think they should be special clinics that
Yeah.
only offer
Yeah.
pain relief to women when they go through procedures. But if we don't ask, honestly,
It's
they're
like you're
just
already
gonna,
vulnerable enough going through that.
yes,
Why should it be painful and
Traumatic.
yeah,
absolutely. So
emotionally
I think when
traumatic
you
for
have
you?
choices, you call around who does the IUD with pain relief and who doesn't, or who does a biopsy with pain relief. That way, I think women will change the field by, you know, demanding it basically,
Yeah.
that we will not go through procedures without pain relief anymore,
Yes, vote with your feet.
honestly. So I think that's really, really important. And I hope that everyone who's listening to this gets encouraged to get their exams done, get the pap smears. And we were going to talk about pap smears and HPV a little bit.
Yeah, let's do that. How often are we doing pap smears?
Okay, great question. I still offer it yearly. I know the new recommendations are every 2 to 5 years. And let me just give you
Really?
some
That is
statistics.
very
Since
scary.
when?
It's been a few years. So if you
That's
Google even
terrible.
American College of Obstetrics and Gynecology, Kaiser will not do, for example, if you have a Kaiser insurance, they will not do a pap smear more than every 5 years. So American
Wow.
College of Obstetrics and Gynecology, you can Google this, published a paper a few years ago. If we adopt the every 5 year rule as a nation, there will be 27,000 more women dying of cervical
Oh, shame
cancer
on
in
them.
America.
Shame on
20,
them.
this is not a joke, ladies. Like 2 years maximum. I still encourage yearly pap smears. Now, the 2 year testing, please understand this is really important, should be co testing with HPV. HPV is human papillomavirus, the virus that causes cervical cancer. If you're just doing a pap, you are not allowed to skip. You need to do co-testing in order to skip. Furthermore, you should have no history of abnormal paps in the past because this virus can stay dormant in your system and show up years later. So the skipping is only for people who've never had an abnormal pap. The co-testing is negative, meaning normal pap, no HPV. And that doesn't mean you don't go in for your cervical exam. So skipping the pap means the swab we don't send in. Doesn't mean you don't go in to get examined, to get checked, to for them to look and make sure they don't see any lesions or
So
issues.
that's what you're doing. Are you spraying something in to seek discoloration?
Absolutely. When we're looking for abnormal cells, we actually use acetic acid, which is the same thing as vinegar, and that makes the abnormal cells light up under the microscope when we look. So, but back to regular screening. So that's the more specialized screening when we do the diagnostic testing. For regular pap, we don't spray anything. We just swab the cervix and the vagina. And just recently, I was sharing with you guys right before we went on to film that I had this experience multiple times in my career that the pap smear was normal, HPP HPV, the virus is positive, and when I did the biopsy, the patient was one step before cancer. So there's a level 1 abnormality, then there's a level 2, then there's a level 3, and then there's cancer. And all 3 of these specific patients that I'm thinking over the past few years had level 3, so not even a level 1 or 2. And if we just relied on the pap smear alone, we would have missed their precancerous, which was extremely serious and deep. So please understand, the more you skip, the less likely you are to find the abnormality, because even if we don't find it 1 year, there's a really good chance we're gonna find it the next pap. But if you're skipping it every 2 to 3 years, then you're really gonna, miss the diagnosis.
I mean, it's wild to me that they're allowing women to go that
Absolutely.
and
This
that
is crazy.
and that's now medical insurances will now take that and not allow women to go
Absolutely.
in to get
Um, Thank God, not yet. Most PPO, I only take PPO insurances, so that has not been the case for us. They still will cover yearly pap smears. I think there's been enough lawsuits also that they are not going to be able to really retract that and not pay for it. However, the average person and listener would think, oh, great, I don't
a
need to go in.
recommendation. Yeah, yeah,
Right.
Yay,
yeah.
Because
I'll
it's
wait till
not
Yeah.
fun.
it's not fun. And you think, "Oh, my doctor said I'm fine.
Yeah, yeah.
Why should I go in?" And they completely miss the part that you need your breast exam, you need your mammogram, you still need to come in to be bimanual, which when we examine you inside, those are not every 2 to 3 years. But the unfortunate part is when we say you don't need a PAP for 2 years, people will not show up for 2
That's right.
years.
So
Because
we're
nobody
That's what
wants
they
to
hear.
do it.
it's
Exactly.
you're saying every year you go in, you get
Exactly.
every year women are going to get this. So we're getting our mammogram, we're getting
Pap
our
smear.
paps, we're getting our
Ultrasound.
Ultrasounds,
ultrasound.
absolutely.
And what else do women need to know to be on top or ahead of great female health?
You're also
I
doing a thyroid ultrasound.
I do thyroid ultrasounds, and in my practice, I have found so many thyroid issues and cancers that it even in young women, athletes, people that you wouldn't think they would have thyroid issues. So I'm a little bit over the top. I think thyroid ultrasound is not one of the requirements. I feel like you're there, it's 2 minutes, there's no pain. Most insurances cover. Why not get a clean bill of health while you're there? And if I find 1 cancer per year and everyone else's ultrasound was normal, I personally never think that's a waste.
Yes, you've
Yeah,
saved that.
Do you know what I mean? Like, people say, "Oh, but you did all these for nothing." Well, that one person doesn't think
That's
absolutely.
that.
peace of
Yeah.
mind.
Absolutely.
And
And
what you
so,
said really resonated. Once you start to have symptoms, it's too late.
game over. Our body will compensate. So most cancers, however, with the breast, please do self breast checks. When you're in the shower and you're washing, be aware of your own lumps and bumps. So, not to be a hypochondriac, but if you've never felt something and all of a sudden you're feeling something, and breast cancer will feel kind of like a knuckle,
Oh,
hard and kind of like not mobile, kind of
Mhm.
sticky. If you ever feel something that feels like a really hard tissue, there's a good chance it's a benign cyst, so please don't panic. But we have to check it out. We have to do a 3D ultrasound, mammogram, sometimes a biopsy, because it'll feel the same as cancer. So if you feel something abnormal, please go to your doctor. Don't think, oh, it's fine.
Wow.
Today has been so enlightening for us, and we're so happy to share our journey
Thank you.
with our listeners. And we're so grateful to have you as our healthcare
Thank you.
partner and somebody that we really admire. And ladies, take care of your health. Keep it
Mhm.
right, keep it tight. I want you to have what she's having, and we want you to have what she's prescribing.
Thank you so
And we will
much.
put up your information so that patients can find you.
But listen, if
Mm.
I call you or Brittany calls you and you're so busy with new patients, you need to put us at the top of the list.
Oh, 100%,
Okay, that's all we
Superfine
always.
ask.
I
cast.
see your names on the schedule and I just get happy. It's
Oh,
Same.
such a pleasure to
we
take care
adore
of
you.
gorgeous, smart, amazing women that care about their health and wellness and educate their friends and family and now the public. I'm honored, honestly, to be your doctor, to be your friend,
Oh,
to be your circle of friends, and truly an honor and pleasure. And remember, seekers are finders, and that's the honest truth.
oh. And one more thing, we are going to have you back on so that everyone can find out what you're having because everything you do is fabulous and you always look
Right back
Yeah,
at
so
both
the
of
on
you.
body, the
point.
face, the skin, it's all good.
Yes,
Yeah, thank you.
Thank you
we
so
love
much.
you.
Thank
Thank you.
you.
If you laughed, gasped, or immediately Googled flights to Paris, we did our job.
Don't forget to leave us a review, 5 stars only, please. And follow along for behind the scenes madness on Instagram, TikTok, Facebook, and YouTube at Official What She's Having.
Catch you next time, and until then, go get yourself something fabulous.